Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
We have a lot of patients who go for infusions, and we might write the order for one particular drug, and that may have been written 6 or 8 months ago. And now the insurance company has changed their minds, and then suddenly they're saying, the drug we gave you before is not on our formulary.
Welcome to Breaking Down Biosimilars, a podcast that brings light to biosimilars and helps you better understand the role they play in your healthcare now and in the future. I'm Zoe Rothblatt.
And I'm Conner Mertens. Both of us are patient advocates and community outreach managers at the Global Healthy Living Foundation. Our goal is to introduce you to biosimilars, what they are, how they get approved, their potential savings, and what promises they hold.
We also hear from a few people who've been taking biosimilars about their own experiences, and we cover some common myths about biosimilars and try to separate fact from fiction.
So Zoe, in our first few episodes, we've learned about what biosimilars are, how they work, how they get approved, and how they've slowly begun appearing in the US market over the last 6 or so years.
We've also heard from a few people currently taking biosimilars for various conditions, and most have said their experiences so far have been positive.
Which is incredible news. But I think this time we're going to have to address the proverbial elephant in the room, which is the cost savings that were supposed to be part of the deal. This is so important to patients.
Right, because despite all the initial promises about how biosimilar medications can significantly reduce prices for consumers, we have yet to see that really happening.
All right, so let's break it down and try to understand why that is and who all the players are in this, because there's a lot.
Well, first of all, biologic drugs are among the most expensive medications in the US. So you'd think that biosimilars should cost way less than biologics because, they cost less to develop and test, like we talked about in episode 1. Because the biologic serves as the reference, we already have that blueprint, and we don't need to repeat all of the trials that the biologic went through.
And they still don't cost any less, do they?
It's complicated, like everything in healthcare. They were introduced at a lower price point than their reference biologic, but we really haven't seen a much lower price to the patient like we have seen in the generic market. And that's because it's up to the insurance companies to decide whether to pass these savings on to the consumers.
And I'll take another wild guess and say they haven't done that.
Nope. And insurers often argue that these savings can be passed through to patients in other ways, like lower premiums, and that's the fixed amount that you pay for your insurance each month. But what we're seeing is that copays, deductibles, and premiums all keep rising. So Conner, I guess that means that patients aren't getting the promised savings.
Okay, but to be fair, experts say that there hasn't been enough time to analyze and determine what savings biosimilars can generate.
Right. And there are a lot of factors at play here. And at the end of the day, what we do hope is that insurers do what they promise and lower premiums for patients.
Dr. Simon Helfgott is a rheumatologist at Brigham and Women's Hospital in Boston. He says sometimes insurance companies will arbitrarily switch a patient over to a biosimilar medication, a decision patients might not even be aware of, and cost considerations might not leave patients with much of a choice.
Most well-run infusion centers will check ahead of time if they want to get paid, obviously, that the patient has coverage, and they will be instructed by the insurance carrier as to what is considered the first-line choice and what is considered a non-choice. We have a lot of patients who go for infusions, and we might write the order for one particular drug, and that may have been written 6 or 8 months ago. And now that patient's insurance has changed, or maybe it hasn't even changed. The insurance company has changed their minds, and then suddenly they're saying, the drug we gave you before is not on our formulary. We've replaced it with this drug, and this drug may be a biosimilar.
And, it's not like the patient can just say, okay, I want to stay on my originally prescribed treatment, so I'll just pay the $50 difference out of pocket.
But hold up, Zoe. Dr. Helfgott mentioned a pretty important word here, formulary.
Good catch.
A formulary is a list of medications covered by your health plan. So what Dr. Helfgott was saying in that scenario is that the list of medications changed. And this is a big deal for many patients living with chronic disease who pick their insurance plan based on what drugs are covered. Okay, back to Dr. Helfgott.
we're talking about insurance companies like Cigna or Aetna saying, we will cover this infusion and it may cost, say, $5,000. If you are getting the brand product, it's going to cost you $15,000. So I think most people will carefully assess that situation and conclude that, no, I will take whatever they're going to offer.
So, Zoe, because you and I are patient advocates, this immediately gets me thinking, what options do patients have in a case like this?
Well, support programs from drug manufacturers play a huge role here. They're often copay assistance programs, which are run by the manufacturer of a drug that help pay a certain amount of the cost that you, the patient, are responsible for.
Right. And I often find these by typing the name of the medication online along with the keyword copay assistance. And you can enroll online through the support programs and get the information pretty quickly. Some of these assistance programs are offered like secondary insurance with a group number and all that information. And some are offered as a debit card with a certain amount of money allowed for the calendar year.
Yeah, all great points, Connor. And it's also important to note that these are for people with private health insurance, not government run plans like Medicare or Medicaid. And in thinking about what other options a patient has in this situation, Dr. Helfgott says that being aware and having the knowledge about your medication and financial responsibility is really important here.
I would tell patients you should know what you're getting. You should know which formulation because each of the infused branded products that have biosimilars, there's more than one now. And you should know what the copayment coverage might be because it may vary. Even though it may be less expensive for your insurance plan, you don't want to be in a situation where your copayment support is now rendered useless and that there's nothing to cover that.
And Dr. Helfgott brings up a good point. As patients, we have to look at our out of pocket costs. So while certain formulary changes are done by insurance companies to maximize their profits, not being able to use copay assistance cards will cost you more money out of pocket. Still, Dr. Helfgott says market forces, i.e., competition, will ultimately benefit patients if their insurance companies pass the savings along to them.
If you're the only one in a certain class and your drug can command a $50,000 charge, there's nothing to stop you next year from saying, we have no competition. Let's go up to $75,000. And that's been a strategy for many companies. And I can understand why. I mean, if you could do it and get away with it, I suppose that's what people do. But that's not really good for our overall economic health. So what will happen now with a biosimilar, there's going to be a competitor. The competitor, in order to get in with the insurance company, is going to have to offer a better price. Better price usually means anywhere from 20 to 40% reduction compared to the original price. So there will be a discount. And so the originator product might decide, well, we don't want to go out of business because if you recall what happens on the generic pill side, once the generic comes out, the original product basically disappears. Companies have given up. But in this situation, a company may not give up with their biological, but that's fine. If they want to remain competitive, they may have to lower their price by 40%. So I think there's going to be a healthy stress, healthy competition on pricing here that we haven't had until now.
And, all of these behind the scenes deals are really not transparent for patients. And the negotiated discounts historically have gone back to the insurance company and not the patient. Dr. Helfgott says there are a lot of players in the mix determining how biosimilars are paid for, who pays, and who gets discounts.
Your insurance company also has somebody working on their behalf called the pharmacy benefit manager.
Pharmacy benefit managers, unfortunately, I know about them all too well.
Yep, they started to pop up around 30 years ago. And at first, all they did was really just make sure that your benefits were up to date and made sure that your health savings accounts were up to date as well.
And then about 10 or 15 years ago, one of these companies realized, we could start procuring these biological drugs and get them available for patients. And they just took off and they became these giant companies. And the problem with pharmacy benefit managers is that they work for their own benefit. I mean, their name is accurate. They're really for the pharmacy benefit. They're not for the patient benefit and not even for the insurance company benefit. And I'll give you an example. If you have a drug, a biological drug that let's say costs $1,000 an injection, the pharmacy benefit manager will have a carve out where they will say to, say, Cigna, okay, we will get that drug for you. You won't pay $1,000. We'll get a discount down to, let's say, $850. And Cigna may say, fine. Well, then they will turn to the drug manufacturer and say, we will get you 10,000 patients on Cigna, but you will give it to us for $650. So the biological company may say, well, we have no choice. We want this business. So they're pocketing the difference between the 650 and the 850. And that's how these companies become very, very rich and powerful very, very quickly.
Roughly a year ago, infusion centers near Dr. Helfgott were rejecting biosimilars because they said there wasn't enough discounts with the contracts they had.
Suddenly, about 6 months ago, everything changed overnight. And they suddenly said, from now on, everything will be biosimilar until proven otherwise.
I mean, it's pretty amazing how things can shift on a dime like that.
It really is. I also spoke with Dr. Robert Popovian, Chief Science Policy Officer here at the Global Healthy Living Foundation. He says that currently the market share for biosimilars is around 10% compared with biologics. And market share means overall uptake of something. And one reason that the market share for biosimilars is so low is because of this thing called rebate contracting, also known as rebate walls.
And they force physicians for patients to use higher priced alternatives that are there because the higher the price, the more rebates and fees are collected by insurers, and therefore it's more profitable for them to use higher priced medicines than lower priced alternatives such as biosimilars. And why have they been even more successful in the marketplace for autoimmune disorders than, let's say, cancer or supportive care products is because of the system we currently have, which is these are chronic diseases that patients stay on for a very long time. And therefore, the rebating system is much more successful in those markets than a cancer therapy that is used for shorter periods of time.
Even so, Dr. Popovian sees the beginnings of a positive trend in the marketplace.
Since the introductions of the biosimilars in the marketplace, the originator prices have dropped significantly. And despite not having a huge market share, there's still price pressure that we see. So it's important to continue this market as it is and continue introducing biosimilars into this market and continue pushing this market forward. Because if biosimilars withdraw and go out of that market, what will happen is that the originator prices will keep going up.
And there's a bit more good news to report.
We all love good news, Zoe. Let's hear it.
Many biosimilar manufacturers are starting to get a bit more aggressive with their pricing structures, offering their products at much larger discounts compared to the originator biologics. In some cases, over 50% less.
That's encouraging. And when you consider that generics at your local drugstore can cost up to 80% less than brand name drugs, it makes sense that people want to see significant savings with biosimilars as well.
Also, some large employers have begun negotiating with their insurers to bring down costs for employees. I was actually looking at a recent study that found that participating companies saved 32% with the biosimilar infliximab compared with its reference biologic Remicade.
And in these scenarios, the out of pocket costs for the patient will vary based on the health plan. But if there are these large savings in the overall price, there's potential to reduce the out of pocket costs for the patient.
And reducing that cost is a huge deal for patients who live with chronic disease and are consistently burdened with that cost of paying for their medication at every refill.
Next time on Breaking Down Biosimilars, we discuss some of the common myths and misinformation about biosimilars and discover where the real truth lies and what the medical facts actually tell us.
Patients will say to me, oh, I don't want a generic drug. I have a hard time with generic drugs. And I tell them, this is not a generic. A biosimilar is a copy of the originator drug.
We hope you learned something new about the biosimilar market here in the US. And if you're currently taking a biosimilar, we'd love to hear from you about your experience. So send us an email to breakingdownbiosimilars@ghlf.org.
And thanks for listening to Breaking Down Biosimilars, a podcast that sheds light on biosimilars and helps you better understand the role they play in your healthcare, now and in the future. If you like this episode, give us a rating. Write a review on Apple Podcasts. It'll help more people like you find us. I'm Connor Mertens.
And I'm Zoe Rothblatt. See you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.